Okay, good morning everyone, and thank you for joining us at our first ever virtual annual general meeting. It's a great shame not to be able to be with you in person at this year's meeting, but in adherence with social distancing guidance for all NHS organisations, we're running this morning's meeting through Microsoft Teams live event. I'm joined by our accountable officer, Sarah Blow, our 6 clinical leads who are chairs of their borough committees, our lay members and 3 guest speakers. You'll only be able to see each speaker one at a time, but the meeting is being recorded so we can make it available for others to see on our website after the meeting. Thank you very much to those who've submitted questions in advance of the meeting. And if you do have a question for the governing body which you've not already submitted, or if you think you'd like to ask something as we take you through this morning's presentations, then please use the question and answer icon on the top right of your screen. Just to say, we're not able to answer questions about an individual's care or cases, but if you've got concerns, then please use the usual routes to contact us. We might not have time to answer all the questions, but we will try and group them so that we can answer as many of the most important issues as possible. Please do bear with us if there are issues with the technology. It's a new way of working for all of us and we're still adapting and getting used to it. So I will just now briefly take you through our agenda for this morning. Next slide, please. So I'm introducing things. I'm going to pass over to Sarah Blow, who will say a few words at the beginning as well. And then we will go through finances with James Murray, our Chief Financial Officer, leading that. And then we're going to hear from each of the individual 6 boroughs that make up our CCG about the work they've been doing over the last year. Next slide, please. And then at the end, myself and Sarah Blow, our accountable officer, will be giving you an update on 2019-20 overall, but also looking forward, talking a little bit about our response to coronavirus and looking forward to this coming year. And then we're hoping to leave plenty of time at the end for questions from the public. I think it's really important we do that because you've not got the opportunity to be with us in person. So we will try and make good use of the question and answer function and deal with some of the questions we've had in advance so that we can make it as interactive as possible in this particular format. Next slide, please. So this is our annual general meeting. That always is a look back over the previous year. For us, that's the story of 6 different CCGs culminating in us merging into a single CCG on the 1st of April. And of course, our first role as a new CCG was our incredible collective response to the coronavirus pandemic. What's clear is that while a lot of our work was focused on our collective South West London response to how we provided hospital services, our previous work as individual CCGs in our boroughs, building relationships and partnerships with local authorities, with the voluntary sector, with health providers, with communities, it stood us in really good stead to respond locally to what's been the most challenging time in our collective history. That's why we're committed to maintaining our focus on those borough relationships as we move forward, as well as doing better what we can at scale across South West London to the best of our ability. I'm now going to hand you on to Sarah Blow, the Accountable Officer for the South West London CCG.
Thank you, Andrew. So I'm just going to talk to you a little bit about the merger where we brought together the previous 6 CCGs, as Andrew mentioned. We have been working together for quite some time and we have developed local health and care plans in each of our 6 local boroughs. The long-term plan said to us that we would need to bring together under one CCG across each integrated care system. However, we had already decided that we thought that we could benefit from working together in a different way as one CCG, while still retaining a real focus on our local systems at borough level. So in early 2019, the CCGs came together as governing bodies and agreed to proceed to discussion with the membership and with our partnerships about how we could develop the single CCG. And together we co-designed our model for South West London. And we did that in a way that recognised the local boroughs as the building blocks of what we do across South West London. Our ambition for South West London is to make sure that we retain the clinical leadership that has been key in our success so far as CCGs, but also engage with our public and also keep the collaborative relationships with both our local authorities, our providers and other parts of our system. Next slide, please. I'd now like to introduce you to James Murray, our Chief Finance Officer.
Thank you, Sarah. I'll just give an overview of the finances of the 6 CCGs as they were last year. Although we are now a single CCG, we prepared 6 separate accounts for last year, so I'll quickly whiz through those. Next slide, please. The first thing to say, really, as people are probably aware, is CCGs are commissioning organisations. We don't provide services, we commission services on behalf of our local populations. We've got Croydon there as an example of how we spend our money, and you can see a big chunk of that money goes on to hospital services, so that's buying services such as A&E, elective care, outpatients, and those sorts of things. We also spend money on community services that provide local out-of-hospital services to our population, and mental health services as well through our local providers within South West London. And the final big chunk there is we commission on behalf of our population's general practice and also prescribing services. So when you go to your general practice, it's the CCGs that's responsible for spending for commissioning that money. What we don't actually commission is things like specialist services and some of the directly commissioned services such as pharmacy and opticians and those sorts of things, which are largely done by NHS England. But you can see from that slide the proportions of the money within Croydon, and we have examples for the other 6 CCGs of where we spend our money. Next slide, please. In terms of the CCGs, and this is true of all 6, we have 4 key sort of targets that we have to hit for our finances, and I'm pleased to say that all 6 of our CCGs hit these targets. So the first one is about maintaining financial stability, and that effectively means living within the resources that you're given. So we've balanced our book, so to speak, across all 6 CCGs, and I'll just go through briefly in a bit more detail on each of those. The second one is fair and effective use of resources, so that's testing effectively how well in terms of value for money are we commissioning our services, and again we've got a green tick on that for Croydon and the rest of our CCGs, which is a good thing, and that's assessed by our external auditors. The third one, which is relatively new to CCGs and came in a couple of years ago, is we are required to demonstrate how we invest in mental health in line with our growth allocations. So that's a key government priority. We get audited on that, and we have to demonstrate how we're commissioning more mental health services for our population. And again, we achieved that for all of our CCGs. And lastly, we're given a management cost allocation, which is £20 per head, and we have to live within that. So that's putting a limit on how much we can spend on our corporate costs. And again, once again, we've managed to live within that for Croydon and all the other CCGs. In terms of the 6 CCGs, then I'll go through in a bit more detail, say each one. But we managed to balance all 6 CCGs. As people are possibly aware, there's a big requirement now as the NHS sort of evolves to look at how we balance as local systems, and South West London is counted as a local system. The great thing in South West London is because we as CCGs managed to balance, and we managed to keep the providers all contributed to balance, we were actually able to balance South West London as a whole system. And one of the positives that that gave us was we actually managed to access a bit of additional financial support last year, which brought a bit of extra money into our local providers and one of the CCGs. So it's a good collective effort from everybody to across South West London to get to that position, and shows the benefit of how we work as an integrated system and the benefits that that can bring to us on the resources front. So just picking up on each of the individual CCGs briefly. So Croydon has had a history of financial difficulties, but I'm pleased to say for the last 2 years it's shown great improvement, and I think that's a big achievement for all the people who've been working in Croydon CCG, that we've managed to balance and bring that financial stability back. So I think that that needs to be formally recognised. Next slide, please. You've got there the spend for Kingston. As you can see, it was a smaller CCG. Kingston has had a great track record of financial performance over the years, and that continued in last year. So they hit all their targets. Next slide, please. As you can see there, so 4 more green ticks, which is all to the good. Next slide, please. Richmond is again, you can see similar size to Kingston. Richmond again has had a difficult time over recent years in terms of finance, but I am pleased to say for the first time in several years it achieved financial balance. So again, I think that's great recognition to the staff within Richmond that they got to that position, and it was a lot of effort to get there. Next slide, please. Again, there you can see all the green ticks for Richmond, so a positive for Richmond. Next slide, please. Going into Sutton. Sutton, again, slightly bigger CCG, has had problems over the last couple of years, and those continue. We've worked very closely with Epsom and St Helier around trying to turn the finances around. Again, Sutton was one of the organisations, as was Epsom, that because we were able to balance the system as a whole, that actually brought additional resource at the end of the year. So it was recognised because South West London had balanced that Sutton and Epsom benefited both at the end of the year from additional financial support. So that's a real positive, but work is continuing on there to make sure that we maintain that financial improvement. Next slide, please. So Sutton, again, with that additional support, ticks all its green boxes, so a strong position given the difficulty that we had in the year. Next slide, please. Merton, again, a similar size CCG to the previous ones. Again, a challenging year for Merton. It balanced its books. It was a difficult year. We had a number of pressures in 1 or 2 areas, but again, huge achievement from the staff within CCG at Merton to achieve balance. Next slide, please. And again, you can see there the positive green ticks for each of those 4 targets I mentioned. Next slide, please. And the last slide there, Wandsworth CCG. Again, Wandsworth has had a strong history of strong financial performance. It's a bigger CCG, more similar to size in Croydon. Again, they achieved balance this year. Next slide, please. And you can see the 4 ticks in there. So as I say, the 6 CCGs have shown a good financial performance. Been a difficult year, and I don't think we shouldn't underestimate the achievement of all staff to get to that position. And again, as I said, it just to emphasise, it's benefited the whole of South West London as overall. So on that note, that's the end of my presentation, and I'd like to hand over to Agnello Fernandez, please.
Thank you, James. My name's Dr. Agnello Fernandez, and I'm the GP Borough Lead for Croydon. I'll have the next slide, please. Just a little information about Croydon. We have one of the fastest growing populations in London, nearing 400,000. We have just residents of Black, Asian and minority ethnic background. Nearly a quarter of the people in Croydon have one or two long-term conditions. And comparing the most affluent parts of Croydon with the most deprived, there's a life expectancy gap of 13 years for men and 14 years for women. Croydon also has the highest child population in London, a fifth of whom are obese, and we also have one of the largest looked after children's population in London. 2/3 of the adults are overweight or obese, and 1 in 17 older people experience loneliness at some time. About 3/4 of people with depression remain undiagnosed. So these are just some of the challenges that we've faced in Croydon and developed our plan to try and improve the outcomes for the patients of Croydon. Next slide, please. So reflecting on the previous year, as James pointed out, one of our great achievements has been at least 120 million savings through transformation and efficiencies since we became a CCG in 2013. Last year, we achieved more of the national standards that CCGs are assessed against. We've made big improvements in how quickly people can access mental health services, but more importantly, the outcomes have been positive, as been reported by patients, and this has been for both adults and children. We've made improvement in waiting times for cancer services and met 7 of the 8 standards, which is again an improvement on the previous year. We're working hard towards achieving the 8th standard, implementing the lessons we've learned from the other standards to help us get more people into treatment quicker after urgent referral from a GP. We have worked to support Croydon residents to manage their health more effectively through a range of programs, including expert patient programs and group consultations. You'll see from the photograph on the top left, Dr. Emily Symington talking here on a BBC program, Trust Me, I'm a Doctor, earlier this year. We have also finalised our partnership with Croydon Health Services, NHS Trust, our local hospital and community care provider. You can see members of our joint executive team, including Matthew Kershaw, joint chief executive and place-based leader in Croydon, in the photographs on the right-hand side. We've also begun to embed our 9 primary care groups, primary care networks with GP practices coming together to set local groups to focus on prevention and health equalities. Building on these, we're also developing integrated care networks, which bring teams of health and care staff together to support local residents seamlessly. We've already implemented our first area in terms of Thornton Heath, and this is already up and running, and we're now planning on a further network in the south of the borough. That just gives you a flavour of what's been happening in the last year. Can I now hand over to Sarah Hack, who is a link worker in Croydon, to tell us a bit more about how link workers have been supporting the people of Croydon.
Thank you, Dr. Fernandez. Good morning, everyone. Next slide, please. Hi, good morning. My name is Syra. I am the social prescribing link worker for 1 Thornton Heath, PCN. My role is to support patients with non-medical issues, and that can range from social activities, online exercise, to domestic violence support, to employment benefits and housing support too. My role also includes supporting grassroots projects where there is a gap in the community. My role is to find some funding, and if organisations are having difficulties, then to support them with their funding application too. I am employed by the PCN. There are 14 link workers in Croydon. There are 9 PCNs. PCNs are primary care networks. I am supported and mentored by Croydon Social P, where I receive my peer-to-peer support. I'm just going to throw a couple of stats. I work across 6 GP practices in Croydon North East. There have been over 5,000 social prescribing appointments with me since I started in 2018. We know that historically, upwards of 20% of GP appointments have been for non-medical reasons. We also have multiple examples from across the borough of people who have been supported to be happy and healthier through social prescribing. A lot of all of our link workers have supported practices and pulled together with partners in the voluntary and community sector to support people during COVID-19, particularly residents who were shielding. More than 2,000 vulnerable households in Croydon received support from volunteers through our partnership at the height of the pandemic. I have played and continue to play a pivotal role in many projects in Thornton Heath. Some examples are Age UK digital support for vulnerable patients, Gig Buddies, who are befriending service for adults with learning disabilities, some projects with Crystal Palace for Life foundation projects. As Dr. Fernandez mentioned about Talking Point, Thornton Heath is an integral part of trialling multi-agency talking point where residents can get support with housing benefits and other issues which can cause stress and anxiety. It is important as a link worker to have all-round knowledge of seamless and immediate support for all patients. Social prescribing in Croydon is supported by the local voluntary sector, which provides a wealth of opportunities for people to connect socially. The One Croydon Local Voluntary Partnership program has funded extra health and wellbeing activities in the community to strengthen what's on offer for residents. There are different ways of referrals at the GP practices. They are done by all clinical and non-clinical staff, and we have sessions on EMIS. Next slide, please. I'm just going to go through a case study just to show you a flavour of something that I've supported, and there are many of our link workers that have supported patients. I had a pregnant lady who was 20 years old, who was sofa surfing. She had lost her job, had nowhere else to go. So she was referred to me through the GP. We came up with a joint plan. And after seeing me probably about 4 times, we had resolved her housing issues, her benefit issues, and she was even signposted to mental health services. She had a very healthy baby boy, and she knew, and also supported her with her legal rights with child support and Healthy Start vouchers. She now actually does not see the doctor anymore, and she only comes to the appointments that are needed for her baby. And that's from me. I'm going to now introduce you to Dr. Naz Jivani, who is a GP borough lead for Kingston. Thank you.
Thank you, Sarah. Hi, I'm Dr. Naz Jivani. I'm Clinical Vice Chair for South West London CCG and also the GP Borough Lead for Kingston. Next slide, please. Just going to give you a few facts about Kingston. When we're talking about our children and young people, we've got about 1 in 200 of our 15 to 19-year-olds who do have issues with self-harm. So hence we've managed to be part of the Trailblazing Fund to try and help support these children and young people. We've also got almost 1/3 of our 10 to 11-year-olds who are obese or overweight. We've also seen more than 2,700 children with special educational needs in school. There are about 25,000 of our population, so that's around about 1 in 8 with depression and anxiety. And we've got around about 1 in 7 of our population who are unpaid carers. In our prevalence, we've got around about 18% of our predicted population are to have hypertension. And of our over 65-year-olds, this is predicted to grow by more than 27% in the next 5 years. We've got more than 8,000 of our over 65-year-olds who do live alone and do need some support, and just under 10,000 of our over 65-year-olds who actually have long-term conditions and therefore need more support from our practices and our community staff. Next slide, please. I'm going to talk about four different areas here. The first is around Connected Kingston. Now, this is providing links to our population towards non-medical activities and services, and linking the communities, and this does continue to grow. Social prescribing link workers have been appointed and have been attached to each of the PCNs in Kingston Borough. In line with our health and care plan, our Start Well area of our plan has worked hard to make sure that we give children and young people with special educational needs and disabilities opportunities to flourish and be independent. Over the past year, we've had more than 1,300 educational health and care plans issued for our special educational needs children, and this is up by over 13% from the previous year. We have over 2,200 who are supported through the special educational needs support. On Live Well, we're concentrating very hard on the long-term conditions, and there is additional support for our patients with long-term conditions through MDT working, which is multidisciplinary team working with our GPs and community colleagues, and especially to support those patients and populations with complex needs. And this does then help create personal care plans for them. And through this individualised working, we're able to avoid unplanned admissions. And we've had 200 fewer admissions in this cohort of patients. Under Age Well, we've provided support to care homes through Your Healthcare Impact Team, and they've supported over 700 people in the past year. And this has helped prevent just under 600 admissions of this population cohort. We've also helped support the rollout of additional training for care home staff, and this includes leadership and also identification of early symptoms of deteriorating conditions. As you can see, we've also met the dementia diagnosis rate for the first time over the past year. And now that I've completed my presentation, I'd like now to pass over to my Richmond colleague, Dr. Patrick Gibson, who is the GP Borough Chair of Richmond Borough.
Thank you, Naz. So I'm Dr. Patrick Gibson, GP lead for Richmond Borough. Good morning, everybody. Next slide, please. There's a lot of commonality with Kingston, with very similar demographics applying to both populations. And as you'll see from my first slide, the dominant themes from our joint service needs assessment in Richmond relate primarily to the mental health needs, especially of our younger people, and the complexity of care issues around particularly our ageing population, and especially obviously in relation to dementia. Carer support, clearly in the context of those two cohorts, continues to be a focus for concern and attention. Next slide, please. So as Richmond CCG, we achieved 79% of our key indicators and exceeded the dementia diagnosis standard in the over 65s for the first time, which reflects the work that was going on across Kingston and Richmond. More people used our primary care IAT psychology services than ever before, and the range of service on offer was expanded to include living with long-term conditions. And we also delivered more NHS treatments to children and young people than ever before, and exceeded the 1920 plan for provision of personalised health budgets. Amongst our challenges, we're particularly focused on redesigning acute and urgent care pathways, and also pathways around diagnostics and outpatients to improve patient experience and outcomes. We're focusing our health checks in such a way that existing health inequalities will be reduced. So within our Richmond highlights of the year under our Start Well, Live Well, Age Well objectives, if I start with starting well, we started well by supporting children and young people with complex health and care needs, disabilities and special educational needs to flourish and to be independent in their local communities. As an illustration of that, at October, the total number of education, health and care plans in place across Richmond was 1,492, which reflected a 9% increase over the previous year. 2,494 children are being supported through special educational needs support. Moving on to Live Well, we provided support to people to stay healthy and manage their long-term health conditions. This year, we particularly built on work with a series of projects aimed at improving access to bowel cancer screening and improving the identification of symptomatic patients by providing GPs with a tool to help them spot the early signs. So in partnership with RM partners, 1,149 telephone calls were made to patients and 188 patients were accessed screening as a consequence who otherwise would not have done so. Moving on to Age Well, we supported people to plan for their final years so that they have a dignified death in a place of their choosing. Over 300 advanced care plans have been created for Richmond residents, with 69% of these being created in primary care and the rest in hospital, the community and our hospices. We've worked with the hospital consultants who've taken a particular lead in positively encouraging staff and patients to have these important conversations to plan for the end of life. Once plans are generated and recorded on our online system, Coordinate My Care, they are available to be viewed by urgent care services, so 111, GP out of hours services and ambulance services, to help make good management decisions which reflect patient preferences. And as a result, we've significantly increased the number of Richmond residents dying in their usual place of residence, with deaths in hospital having been reduced. So finally, I'd just like to take the opportunity to recognise the commitment of all our workforce in contributing to these incremental improvements and to thank them today. So I'm now going to hand you over to Kinga Kwasinska from Mind, who's going to tell you about some excellent mental health work on our patch. Thank you.
Thank you, Patrick. My name is Kinga Kwasinska. I'm the service manager for Richmond Borough Mind. I'm here to tell you about Journey Recovery Hub, out of our service, which provides mental health support to people who feel emotionally distressed and or at risk of entering a mental health crisis. The service is open in each of the boroughs of Kingston and Richmond. They are both run by the charity Richmond Borough Mind and funded by CCG in Kingston and Richmond. Journey Recovery Hub provides out-of-hours support to those living with mental health problems, aiming to prevent escalation, reduce isolation, increase independence and self-management, and improve well-being. The main aim is to support people to reduce immediate crisis and to safety plan for them, drawing on strengths, resilience, and coping mechanisms. The service is delivered across the boroughs of Richmond and Kingston. The service is accessed by referral or self-referral. Referring agencies include GPs in Richmond and Kingston, SPEAR, SLAM, A&E, Mind in Kingston and Richmond, First Response Team, and the local trust. Since December 2019, when we first started, we have seen over 120 people in our hubs. The Twickenham hub is located near Twickenham Green, and the Kingston hub is located near Surbiton train station. Opening times are coordinated between the two locations, so the service operating hours are always from 6 till 10 p.m. Monday to Friday, from 2 p.m. till 10 p.m. on Saturday, and Sunday 2 till 8 p.m. We are currently offering blended service. That means that Monday, Wednesday, Friday and Sunday, we offer support remotely, over the phone or online. On Tuesday, Thursday and Saturday, clients receive face-to-face support. Due to limited spaces and social distancing rules, we have introduced a booking system. When we receive clients' referral or self-referral, we get in touch to book their visiting slot. That's maximum appointment time of 90 minutes. Visitors are being asked COVID-related screening questions prior to their visit. So what do you expect to find when you get to one of our hubs? You will be asked to social distance or use a face mask if the safe distance cannot be maintained. You will have your temperature taken at the point of entry. You will be asked to sanitize your hands using a hand gel or wash them with soap or warm water. We'll ask you not to bring any drinks or food to the side. Water will be provided if requested. So who can attend? Adults age 18 or over who are residents of Richmond or Kingston boroughs who perceive themselves to be in mental health crisis or at risk of moving into mental health crisis. Next slide, please. So what do we mean by crisis? So having a mental health crisis can mean different things to different people, but can include thinking about suicide or acting on suicidal thoughts, having an episode of psychosis, doing something that could put yourself or other people at risk. And so I have listed who we can work with. We've got an exclusion criteria, and that will include adults with dementia, children, people exhibiting violent or aggressive behaviour, people under the influence of drugs or alcohol, non-residents of Richmond, Kingston, Merton, Sutton and Wandsworth. The recovery hubs provide a safe, welcoming place where adults can find support from a team of experienced support workers outside of normal working hours. It is hoped that we help to reduce pressure on existing NHS services, such as accidents and emergency and 999 crews, who are often called to support people in distress. For more information on the recovery hubs, please visit our website, www.rbmind.org/recovery-hub. I will now hand over to Dr. Jeff Croucher, GP Borough Lead for Sutton. Thank you.
Thank you, Kinga. Good morning, I'm Dr. Jeff Croucher. I'm the GP Borough Lead for Sutton. I'm going to provide you with an overview of Sutton's key population health needs and then describe some of our achievements and our future challenges. Next slide, please. The information on this slide has been previously identified. We've used it in the Sutton's Health and Care Plan, part of the 5-year strategy for all our health and care needs across South West London, the Start Well, Live Well and the Age Well that we are all undertaking. I want to give a flavour of the local issues for Sutton. We want all our children to start well. 1 in 8 of our children in Sutton schools have a special educational need. 1 in 12 of our 5 to 16-year-olds have a mental health condition. And Sutton has an above average rate of for South West London of hospital admissions as a result of self-harm in the 10 to 24-year age group. We want our adults to live and age well. Around a third of our population of 200,000 have a long-term condition such as diabetes or a chronic condition that affects their lungs or heart or kidneys, for example. We are aware that there will be nearly a 5th increase in people with learning disability in the next 10 years in our borough, with the largest increase being in the elderly group. The largest majority of adults in our borough are physically active, but we want to increase that further. A significant minority of adults in Sutton consult primary care due to social isolation or loneliness, and our social prescribing agenda is developing well. We have identified a demand for increased social care support and this has been identified from both caregivers and care receivers in our local community. We have identified that the time to transfer people requiring hospital discharge, this time has reduced significantly, and that's occurred since we've integrated the way hospital and community discharge teams work together. Next slide, please. We have further developed the way our services integrate and deliver health and care, enabling us to address the needs of our residents faster and more effectively and improve the experience of the care that they receive. Sutton Health and Care has been an organisation that combines many of these services together, preventing hospital admissions, supporting discharge arrangements in and around our hospital services and extending their role into the community. This has enabled much more of an integrated approach between our primary, secondary and community care teams. Sutton Health and Care works well, and it means that services and the services that our residents and patients use only have to tell their story once. We have developed 4 primary care networks, fully integrated with teams of community response, extended into care such as end-of-life care, care home support and social prescribing and cancer care. We're also really proud of our Not Alone in Sutton work, breaking down barriers, providing support for the situation that many find themselves in with domestic violence. We've connected the national experience in this with local services such as hairdressers, beauticians and primary care. We're proud of our achievements around local ambulance times, better than the London averages. We're achieving well against national cancer standards, and our diagnosis of dementia, the rates are high. We've exceeding the expectations of access targets for access to counselling through our improving access to psychological therapies. We are aware though of some challenges still to address, and we have clear plans to improve our A&E services, our referral to treatment and our diagnostic access. Lastly, we are particularly pleased to report on the improvement of services for our children with special educational needs and disabilities. Next slide, please. After a joint inspection from CQC and Ofsted in the spring of this year, they have identified a significant improvement in the educational services for children and young people with special educational needs and disability in Sutton. There is a local improvement in the way that services are integrated between the council, our schools and the NHS. We have been commended for our new structures and our integration of designated health teams into this service. And as a result, improved performance has been seen in both the number and the quality of our educational health and care plans. We have had greater ambition in this area, and it has produced greater outcomes for some of those families most in need. Next slide, please. So we've set our sights and we have developed our plans for the SEND of the future. To strengthen working arrangements with parents, we are really committed to do this, and our parents are indicating that this is an area they wish to work with us. And we continue to work on the annual review process, improving both quality and timing of this part of the service. Thank you. I'm going to hand over to the GP Borough Lead for Merton, Vasa.
Thank you. Good morning. I'm Vaswanyana Pragasan, Borough Chair for Merton. Next slide, please. So our usual plan divided into 3 sections: start well, live well, age well. So I'll pick out the children, the 3% of children in our borough of Merton, young people and people in school with social and emotional mental health needs. In live well, we can pick out our work in diabetes and work which will address to reduce the years of gap, life expectancy loss between the deprived population and the population which is not deprived. We focus on the number of carers we have and increasing number of people with dementia. Next slide, please. There's a lot to talk about, but I would like to pick out 3 things to focus on. The first thing I would like to talk about is the Mental Health Trailblazer project, an innovative scheme which brought mental health workers into teams, into schools and colleges, helping young people build emotional resilience through one-to-one support, through whole class sessions and mental health first aid training for teachers. The second project I would like to highlight is the East Merton Health Accelerator project, a new service offering recovery support including yoga, hydrotherapy and group walking for people signed off from work due to mental health or musculoskeletal conditions. Merton GP hubs we set up, which expanded into 6 locations, 1 in each PCN, making it easier for people to obtain appointments 7 days a week. This meant we could offer 50,000 new GP appointments, covering an extra 55 hours of additional true increased capacity. Finally, something close to my heart, emotionally and literally. As age, gender, ethnicity and culture conspire against me, diabetes is something which I personally have to take seriously, but it's also a problem for the people of Merton. The investment in diabetes in Merton under leadership of my predecessor, who chose to fund 2 key projects. When COVID came along, I sincerely hoped that it would prove my predecessor was wrong to focus on diabetes. Sadly, it was not to be. The 2 projects which we are looking into Merton, in particular in diabetes, project 1 was a project we started to actively seek out people who were at risk of diabetes, to promote healthy lifestyle to prevent diabetes. The second aspect of the project was to fund diabetic nurse specialists to work at each individual practices, supporting patients to better manage their condition, empowering them, improving the number of people who are able to self-care, and also an awareness of the targets we need to achieve to prove that we are actually improving the quality of diabetes. Merton was indeed proactive, and we continue our focus on diabetes, a community-based model. And I'd like to take this opportunity to thank all those in Merton who have helped us achieve this and all the other projects. Thank you. I would next like to introduce Dr. Nicola Jones, Clinical Vice Chair in South East London and GP Borough Lead for Wandsworth.
Thank you, Vasa. Next slide, please. Thank you, Vasa. So Wandsworth is an inner London borough, and so it has some characteristics that reflect this. There are areas of affluence in close proximity to areas of high deprivation, and that leads to health inequalities. We've got a high incidence of mental health issues, and there's a big difference in life expectancy between people in the most and least deprived areas, a difference of about 7 years in men. In this slide, you can see some of the challenges in Wandsworth that our Borough Health and Care Plan seeks to address. Next slide, please. In the last year, great progress has been made and has resulted in some excellent new initiatives that have improved access, worked towards reducing inequalities, and have really made a difference to patient care. One example of this is our eye care service that went live in January in 25 opticians. Patients with minor eye problems can now be seen quickly, locally, and often without going to hospital. And previously, a person with glaucoma who would go to the hospital at least once a year can now be monitored by their local optician. General practice in Wandsworth has historically been very strong, and the 2020 patient survey once again identified that patients rate their GP practices very highly in comparison to other areas nationally and in London. A major change for our practices has been the creation of primary care networks. Now our GPs work together in groups of practices, providing services such as social prescribing, which it may not be possible to do in every practice. Back pain, neck pain and knee pain are all common reasons for consulting a GP. Sometimes those problems need specialist advice or physio, but often patients just need a bit of help to get them on the road to recovery. And we've got a new app called Get You Better, which helps people self-manage their back and joint pains. And more than 3,000 patients have been prescribed the app, with uptake of about 70%. Bowel cancer screening is very effective in identifying bowel cancer early when it's most amenable to treatment. Wandsworth's 40 GP practices have been encouraging people to have screening. We know that some people are very reluctant to return their test kit with their sample, especially men. Patients are contacted by a health worker to try to identify barriers to taking the test, and they're provided with information or sometimes just encouragement and resent a test kit. Uptake increased by 16% as a result. And with the right early interventions and lifestyle measures, heart conditions, stroke and diabetes can be prevented. Our population is diverse, and we've been working with local communities to find ways of reaching people who don't naturally present to health services to work with them on prevention. We worked with the Wandsworth Community Empowerment Network, local faith and community leaders and public health, and 25 community champions were trained to be health coaches. We held events in churches, mosques and community centres. Over 400 people had a health check, their blood pressure and weight was measured, their risk of diabetes assessed, and they were given information and had conversations with the coaches about ways to improve their health. The checks identified that 60% of those people had a high risk of developing diabetes and 25% actually had high blood pressure. Further work's planned to build on these events and work with people in their communities, upskilling them and helping to reduce health inequalities. Our high numbers of people with mental health problems has prompted us to develop a service called Primary Care Plus. Every GP practice has a dedicated mental health worker. This is a person who is based in the GP surgery and who supports people with serious mental illness. These are people who've been discharged from hospital follow-up but nevertheless remain vulnerable. Often they're at risk of mental health problems recurring and also can have poorer outcomes from physical health problems. Having a support worker locally makes a big difference to the person's ability to access healthcare, and this is another way that we're trying to reduce health inequalities in the borough. Our managers and clinical leaders have worked in collaboration with colleagues in health and care services, as well as the many voluntary organisations in Wandsworth, and in partnership with our patients who continue to provide us with their expert insights into how we should design services. I'm going to hand over now to Dr. Nikki Williams, who's a Wandsworth GP and clinical leader.
Thank you, Nicola. Hello, I'm Dr. Nikki Williams. I'm a GP in Wandsworth, and I've been working with St George's and Merton and Wandsworth GP practices as part of the Outpatient Transformation Programme on something called the Gastroenterology Clinical Assessment Service. Next slide, please. This service is currently available to all patients with digestive problems who are registered with the Merton or Wandsworth GP practice. The patient's referred to the hospital where they're virtually triaged by a consultant who will then either book them straight for further tests or an appointment if that's more appropriate. This service has been developed as a direct result of patient feedback. Patients were telling us they were waiting too long for their first outpatient appointment and then had a further long wait to receive test results. And they also were telling us that communication could be improved all the way along their pathway. The service is suitable currently for patients with digestive problems such as heartburn, irritable bowel disease or inflammatory bowel disease. Suspected cancer patients are still referred down pre-existing pathways. However, inevitably some patients are picked up through this service. As a result of the clinical assessment service, the time taken for a patient to get a diagnosis and a management plan has been reduced from on average 6 to 9 months to 8 to 12 weeks. We've developed it as a very patient-centred service with a patient coordinator and a clinical nurse specialist to support patients through their investigations and their treatment plans. All letters are written to patients, copied to their GP in plain English. This is particularly helpful for patients who may have access issues and problems accessing a virtual pathway. Next slide, please. This flowchart shows the patient pathway from when they see their GP. Rather than go through this, I will use a patient case study to just demonstrate how this works. So a 26-year-old lady presents to her GP with a change in bowel habit, so constipation and diarrhea, and also bloating. This has been going on for several years and is starting to impact on her life. Her GP did some basic pre-investigation blood tests and stool tests. One of these tests came back slightly abnormal. She didn't meet any criteria for an urgent referral, and under the old system, she would have waited 3 to 4 months for her initial appointment at hospital, a further 6 weeks potentially for her tests, and then would need to attend a follow-up appointment to receive her results, and then potentially be referred on for further management. She was actually triaged directly to tests as the GP provided essential baseline investigations which enabled her consultant to do this, and she had her test 6 weeks later. The results were then virtually reviewed and they were all normal. The consultant was then able to write a letter to the patient telling her results were normal, advising her on how to manage her ongoing symptoms, but also referred her directly on to a dietitian. At the end of the letter, there was an option for her to contact the service to book an outpatient appointment should she wish to discuss this further. She didn't make this appointment, and so her pathway was reduced from 30 weeks in total to 7 weeks. Patient feedback has been incredibly positive, and patients like the speed of getting their results and not having to take time off work for appointments. GP feedback is also very positive. They find it very easy to use. We are continuing to evolve the service based on all feedback and also wanting to expand it to include surgical specialties and liver problems. And we're also looking at whether there's a potential to use the same model in other specialties. I would now like to hand back over, to Sarah Blow, South West London CCG Accountable Officer. Thank you.
Thank you, Nikki. So just back to me to talk about the future and our year to date. Thanks to all the presenters so far on the wonderful work that's been happening over the last year across South West London in each of the boroughs. But it's really important that we also look forward to what's happening now and what will happen over the coming year. Next slide, please. So my first slide just sets out the new CCG, which I mentioned before we started, and the process that we are using for the governance of the CCG. And as you can see, we have a very strong focus on our boroughs and our local borough committees as part of the South West London CCG. We also have all of the prerequisites for running a statutory organisation through our various committees. Next slide, please. So last year was a big year for us in the respect that we had done a lot of work over 2 years to look at the future of Epsom and St Helier Trust. And following a full public consultation, there was a decision made by NHS South West London CCG and NHS Surrey Heartland CCG to invest £500 million into modernising both Epsom and St Helier hospitals and consolidating some services into a new hospital build at the Sutton hospital site. We've been working on this for some time, and our clinicians have had full involvement in the work that we are doing. We recognise that this will provide care that is fit for the future for all of our populations moving forwards. And now that we have made that decision, we are able to hand over the responsibility of delivery to Epsom and St Helier Trust. However, the CCG will retain responsibility for ensuring that they deliver the recommendations that we have made as CCGs on that build. And that will include looking at things like travel and extending bus routes, looking at parking, but also making sure we have the right bed capacity, and that there are opportunities for us working both with the hospitals and with community and primary care for the future. Next slide, please. It was also quite exciting that not only did we become one CCG in South West London, we also were awarded integrated care system status by NHS England. And that's the partnership that we have built not just with the CCG, but with all of our providers and also all of our local authorities and our community. And what that has done is recognise the good work that we have done across South West London in coming together to work for the benefit of our local populations. We developed the Start Well, Live Well and Age Well plans, and we developed our local health and care plans at borough level, all as part of our integrated care system. We believe now that it has benefited us, not just in our day-to-day work, but in our response to COVID, because the collaborative working and the partnerships have proved really strong throughout this very difficult time for the NHS and for the country. Next slide, please. Equality, diversity and inclusion is a major priority for us in South West London. We have had established programmes of work in every borough, but the pandemic has brought to us a sharp focus on some of our community groups. And we know that we will need to focus more of our efforts and more of our resources on ensuring that we deliver the right services and the right outcomes for our local populations. So we are starting up a work stream to look exclusively at equality, diversity and inclusion, and it will be one of our main priorities for our ICS going forwards. The programme will be split into 3 parts: staff, citizens and place, and we'll be setting really bold ambitions for the future. We hope that we will be able to take forward this work in a way that we have done with children and young people mental health that Andrew will talk about later. It's important to us that we achieve the best outcomes for all of our populations across South West London. Next slide, please. It's also worth just saying that we've done an awful lot of work, as we've mentioned, and the borough leads have mentioned, around our local health and care plans. But now that we are in COVID and we are starting to understand some of the opportunities as well as some of the challenges around COVID, it's time for us to refresh those plans and to take into account the lessons that we have learned. So we will be working with all of our partners over the coming months to make sure that we retain all the good things that are in our plans, but we also look at if there's anything else we need to change or update within those plans. And that will be worked on over the next 6 to 12 months. Next slide, please. So I would now like to hand over to Dr. Andrew Murray, our chair of South West London CCG.
Thank you, Sarah. So as we already mentioned at the beginning of the AGM, there was an incredible response in South West London from across our health and care system to COVID-19. So let's go on to the next slide. I think we've talked about this a lot, really. The work that's gone on in boroughs to build local relationships and ways of working together, it really came into its own in the response to COVID. I think the relationship between NHS organisations, local authorities, care homes and the voluntary sector, it allowed us to respond as a system, not as individual organisations, and that's meant we've been able to respond much better to the challenge that COVID has posed to us. I think as well as working in boroughs, it's also worth calling out the work we've done across South West London, because we've particularly been able to strengthen relationships between different hospitals in South West London. They've been providing mutual aid and support across the organisations as they've needed it from time to time, and the collective response to bringing intensive care unit capacity together and making sure we had the right services for patients when they critically need it has been incredibly impressive and a really good example of effective joint working. Next slide, please. So it's worth saying that we've been thinking for a while about how we would respond to a second wave of COVID, and we're continuing to plan actively for that. At the same time, we're accelerating our return and recovery to normal levels of health and care services for non-COVID patients. And it's been a big focus for us, even from the very early phase of our response to COVID. We have been thinking about this and planning for it. We're also preparing for winter and the pressures and demands that that brings. And we're planning on running the biggest flu campaign in the history of the NHS to really make sure we effectively protect all our patients and public from the challenge that flu might bring on top of COVID. We're also working to embed the learning from all of the work we've done and on our experiences so far during this pandemic. So that involves locking in positive changes. There's been some great examples of using virtual access to healthcare services to improve access for people and to improve the timeliness of our response in a safe way. At the same time, we recognise that's not suitable for everyone, and we need to learn from some of our experiences and tackle some of the challenges we've faced during COVID as well, particularly around supporting our staff, continuing to take action on health inequalities, and we must make sure that we don't lose our focus on prevention. The diagram at the bottom here just shows you how we've structured our response to recovery from COVID in South West London. So there's a range of different programmes that allow us to focus on different aspects of health and care services. So I'll just call them out. We've got specialised and cancer care, and I chair that particular programme board, planned and critical care, and there's a huge amount of work going on underneath that programme in terms of looking at a number of different specialties and how we restart them safely and effectively in this new context. There's a group looking at urgent and emergency care, mental health and learning disabilities, primary care, integrated care, which is about community services outside of a hospital setting largely, and a group focused on strengthening communities that's chaired by the Chief Executive of Kingston Local Authority, which I think demonstrates how we really are working together across our health and care system in South West London. There's a number of enabler programmes as well, such as focus on workforce, use of digital technology, communications and engagement that underpins everything that we do, finance and at scale, and there's a lot of new financial rules about how we manage money in the current context. A group looking at the health and care landscape, making sure we have sight of performance and quality across the range of health and care services that we're responsible for, and a group also looking at the best use of estates in the current context, so our hospital buildings, but also buildings outside of a hospital setting. So next slide, please. So it's important probably just to flesh out some of the principles that we've applied to our response to COVID and our recovery from COVID. So clearly our approach has been grounded in national guidance, in the experiences and reflections of our health and care staff. And actually early on in COVID, we conducted surveys of hospital doctors and GPs, so they could tell us in real time what were the things they were most worried about, particularly around delivering effective care for their patients, so that we could adapt our response to that and make sure that we took that into account and manage some of the risk that exists when you're responding to a pandemic. We're listening to feedback from patients, the public and local leaders to try and make sure that the services we provide really do meet the needs of local people. And we're building on over 2 years of public and clinical engagement and strong partnership working as a health and care partnership in South West London. So we're not starting from scratch in our approach to that. It would be fair to say we're continually learning from the views of citizens and staff across our partnership. There's been a great piece of work done pan-London on this, but we've done a lot of work in South West London specifically on gathering insights from citizens and staff and making sure we feed that into all the work that we're doing. We want to continue to communicate and engage with our communities, particularly giving key messages. I think one of the key things that I will come on to is making it clear that health services really are safe and accessible for people, and I'll talk about that on one of the subsequent slides. There's no doubt all of this will continue to be a challenge as we respond to a potential second wave and as we plan for winter. I think I wanted to say one more thing about engagement. It was just to give you an example of where I was really proud about where we've got to with thinking about patient and public involvement. So we've set up clinical networks across South West London for particular specialties like urology services, for example, and we're setting one up for cardiology services, which is to look at those specialty services, how we can deliver them better when hospitals work together, and how we can start to work through a backlog of patients who haven't managed to get the treatment they needed because of COVID. And I was talking to one of my GP leads, because each of these clinical networks is led by a hospital doctor or clinician and a GP or out of hospital clinician. And that was a really key principle to our approach to services, because we wanted people, even our ultra specialists working in a tertiary hospital, to think about the end-to-end journey that patients take when they have one of these conditions. And that's why we wanted the GP perspective and the secondary care clinician perspective. And I was talking to my GP leads, and a number of them said to me, I asked the question, what are you doing about patient and public involvement? And they said to me, we've already taken the initiative on that. All the work we've been doing, we've been taking through patient groups that already exist, and we've been involving patients in the work programme. And I didn't have to ask for that. That just demonstrates the way that our clinical leaders have embedded in their brains the importance of patient and public involvement as part of everything that we do. And I was just tremendously encouraged when I heard that. So next slide, please. So this is just an example of one of the campaigns that we've been running, the NHS is Here For You campaign. So there's no doubt that during the coronavirus pandemic, there has been a decrease in people accessing NHS services for a range of different conditions that aren't related to coronavirus. Now that's been impacting adults and children attending A&E departments for urgent and emergency medical issues such as stroke and heart attacks. People have delayed presenting, and that is really not what we want. Potential cancer patients have been not sometimes presenting with new symptoms, not seeking the care they need, and patients with mental illness haven't always been seeking the care they need. We do recognise that many people were worried not just about their own safety in accessing health services, but also they were worried about putting extra strain on the NHS. So this campaign was really focused on reassuring people. Firstly, NHS services are safe for you to use. Secondly, if you've got important health conditions, we really do want you to access services. That is what the NHS is about, and we are here for you. And that was the essence of the campaign. I think it's worth saying we do have capacity to deal with patients with important problems, and that has been the case throughout COVID, but we've put a huge amount of energy into making sure that's the case, not just for people with new symptoms, but that we're working through any sort of backlog or waiting list that has developed from the initial response to COVID. It's probably also worth calling out the GP involvement in this. I mean, our GP leads from each borough have made a fantastic film to reach out to people in their communities, and GPs have been working in very different ways to support patients. We've been trying to prevent people from coming into GP practices when they don't need to, so we've seen an increase in the use of phone and video consultations, and if you try to access your GP, you will almost certainly be asked to do a phone and video consultation first in order to work out what the problem is, and then if you need to be seen, our GP practices are offering face-to-face appointments, and they will see you face-to-face when that will improve the quality of care that they can deliver. So I hope people have heard that message. We will continue to focus on giving the message that the NHS is here for you. Next slide, please. So this is a subject that is very close to my heart. I've been the clinical lead for children and young people's mental health for the last couple of years, and I'm delighted that we've got the opportunity to include it in this AGM as a really good example of a piece of work that we've done across all our boroughs and that was led at a South West London level. In January 2018, we properly launched this programme to focus on children and young people's mental health, and I was interested actually in looking at the different borough presentations. So many of them called out the issue of children and young people's mental health. The only thing I'd take issue with is some of the stats that actually, to me, the percentages look low, and that's probably because the numbers we're using is those that we actually know about. However, from other information that we have across the country, we know that the actual rates of mental ill health in our children and young people is higher than the official stats. And we also know that we have been seeing an increase in self-harm, particularly in adolescent girls. And that was really one of the key things that gave us impetus for this programme. So there's a number of different elements that we've been focusing on. Probably I'll start at the 4 o'clock position of this diagram. There is a single point of access for children and young people's mental health services. It hasn't always felt like a point of access to people, and we're committed to making sure that we have a similar standard offer in each of our boroughs, and that genuinely we enhance access to significant mental health support when our young people need it, so that they don't need a referral to go through a single point of access, but actually they can get the help they need much more easily. So we've been doing some work on that. We've been looking at non-medical interventions for children and young people's mental health, recognising that often it's not just mental health support they need specifically, but there's a range of other things that can support emotional well-being in our children and young people. There's a lot of services already in place in South West London, but not everyone knows about them. So the next bit is we've been pulling together for each of our boroughs a directory of services for health and well-being that will support emotional well-being in our children and young people. There's a specific focus in our project on supporting parents and carers who have a critical role in helping their children and young people that they care for to improve their mental health. And then the final bit is mental health support teams, and this is all really built around a focus on schools. So what we've done, the approach we've taken is built on evidence and of best practice elsewhere. We've focused on a whole school approach to emotional well-being, because children and young people spend so much of their life in a school setting. It's a really critical way that we can intervene. So we started by creating clusters of schools in each of our boroughs, which involve primary and secondary schools, with a lead head teacher leading that cluster. Each cluster now has expanded to 8,000 pupils, and in each cluster of schools we've provided a mental health support team which involves psychologists and emotional well-being practitioners, a whole new workforce that we've started to roll out in South West London, focused on emotional well-being for our children and young people. And we've been very fortunate in that we've been able to bid for national funding, because this is part of a national Trailblazer programme, this whole school approach, and we've been incredibly successful in bidding for national funding. So we started with 3 national Trailblazers. That's expanded to 10 over the subsequent waves of application, and we've got another 3 in the pipeline. So we're the biggest area in the country now as a trailblazer for children and young people's mental health. And the mental health support teams that we're putting into the schools, they're able to deliver workshops, one-to-one therapy, group therapy, and to support the teachers in the school with a really effective, comprehensive approach to emotional well-being. Another good example in terms of supporting parents and carers is in those clusters of schools, we've rolled out an Empowering Parents, Empowering Communities programme that gives parents the skills to support their young people, and also to train other parents to do so as well. And I think one of the other things I'd like to call out is the incredible work that our teachers have done in this. You know, it's now being led by head teachers. They're meeting together as schools in their cluster on a regular basis, and they share best practice. So the scope of the programme has gone beyond all the health interventions we thought we were putting in, and actually now they're sharing great examples of good practice between the schools and supporting each other. So it's gained a life of its own, which is incredibly exciting to see. I think the final element to call out, and that's probably reflected in the pictures you can see on the screen, is the way we've involved children and young people in this approach as well. All the language that we use in promoting the work we're doing and engaging with young people has come through an extensive programme of testing with children and young people in our schools, what language they tend to use when talking about mental ill health, what images resonate with them, and the communication team have done an incredible job in pulling this together. The other thing is that when we actually went to commission online support for young people, so we now provide for all the children in our cluster schools online counselling and online support, and actually it was our young people in one of our schools who made the decision about which provider of online support would be best, and we got the providers into the school, and the young people themselves grilled them and challenged them and actually tested the products themselves, which I think is a really good example of how you do commissioning effectively, involving with people who are actually engaging with people who are actually going to be using the service. So next slide. So just a little bit more on mental health. So what we did in having the building blocks in place in the relationships with schools and these clusters of schools and mental health support teams embedded in the schools, it gave us a real opportunity to respond effectively to what we have seen in terms of an increase in anxiety and other mental health issues in our children and young people because of COVID. So we were able to take the decision to roll out the Couth online support to every child and young person across South West London, not just those in our schools who are linked into mental health clusters. Our mental health support teams moved to doing a lot of their work virtually online. So they've been doing one-to-one group therapy workshops virtually online. We've set up a website for children and young people in South West London to give them information about all the services they can access. Some of our mental health support teams set up new telephone hotline services. That was done in Croydon, really good example of local innovation. Our Empowering Parents programme has gone online, so that's now got a Facebook page and YouTube content. We were able to connect with the teachers using digital platforms, and all our teachers in our Trailblazer schools did welfare checks on their children who were at home to identify vulnerable children, and picked up a number of children who they wouldn't have been aware of who needed extra support and help during COVID. And then finally, actually COVID has increased the collaboration between the mental health support teams across the different boroughs, and they've been sharing best practice between themselves. So actually it's really driven on some of what we needed to do, having to respond collectively to COVID. So that's it from me on children and young people's mental health. Next slide, please. So that is the end of the presentations from us. We're now moving into the interactive phase of our AGM, and let's see how smoothly this goes. It's the first time we've done this. We've got some questions that have been submitted in advance, and we've been taking questions and comments as we go along. So the way we're going to do this is our Director of Communications, Charlotte Gorn, is going to take the themes from the different questions and present them to me, and then I'm going to be asking different members of our governing body to respond to those questions, and we'll do our best to get through as many different themes as possible. All the questions we've had in advance we will respond to in writing, and if some of our responses are a little bit short at this stage, be assured that if we need to, we will supplement those with written answers to the questions as well. So Charlotte, over to you.
Thanks, Andrew. So yes, so I'll try and summarise the questions from the comments box, which are all coming up now, which hopefully you can see on screen. If you just look at the little question mark in the speech bubble, if you're watching, you should be able to see them too. So before we move on to the questions in the comments box, Andrew, just to summarise some of the questions that we've had so far in writing for you. So Chris Manning has written to us and asked us about the status of social prescribing across the particular constituent boroughs of our CCG, and he says, how are GP practices taking to it?
I think that's a good question, because social prescribing, we knew it was important before COVID, but in COVID, I think in some areas we've seen it's really come into its own. You've already heard some great examples in the presentation from Croydon and Merton about the effectiveness of social prescribing. What we do know is that in each of our boroughs, there's at least one social prescribing link worker or community connector in each primary care network. So each grouping of GP practices has its own social prescriber, and some have more. So I think we're very pleased with how it's being rolled out and adopted, and universally I would say GPs are starting to see the benefits of that in terms of providing a better level of support for patients.
Thank you, Andrew. So we've had another question from Sarah Bird. So Sarah Bird has asked us to define good care and accountability. And Sarah, you've raised some other quite specific issues, which we'll get back to you on later. But Andrew, do you want to have a go at defining good care and accountability?
I will have a go. It's a very good question. Obviously, it's fundamental to what a CCG is and does. I mean, as a commissioning organisation, our responsibility is to make sure that health services meet the needs of our population as we plan and buy and monitor the quality of health services. I mean, that means we need to make the best use of public money that we get given to commission services. We do a lot of work to assess the needs of our populations. I mean, that's done on a borough by borough basis, often in partnership with the local authority through a joint strategic needs assessment, but we also do look at that at a South West London level. And at the moment as well, we're particularly focused on addressing variation and looking at the issue of health inequalities. I think it would be fair to say we know that some people experience excellent care, but others do have less positive experiences. And as a CCG, we use a mix of data to understand how services are performing. So that includes things like waiting time data, quality reporting, contract monitoring, patient feedback, and then pulling all that together, we take action with the providers of health and care services to address those problems.
Thank you, Andrew. Okay, so we've had quite a lot of questions from Wendy Micklewright. Thank you for writing those in, Wendy. You've made several comments and voiced your quite specific concerns about mental health services, Wendy, so thanks for that, and we'll come back to you in writing on those questions that you've asked. Adrian Britton, now you have submitted some questions in advance and also you've posted some. So if I just take the second one of those, which is you say, I'm pleased to read that the 6 boroughs have an agreed common policy for IVF. Has the South West London CCG inherited other borough policies which are not common to all the boroughs? And if so, can the meeting give some examples? And what will we action to make sure we achieve comprehensive commonality?
So it'd be fair to say, I think it's the IVF's a really good example. It was one of the first things we did as a new CCG was to harmonise our IVF policy across South West London so that wherever anyone lived in South West London, they got the same access to IVF. We also have adopted an evidence-based interventions policy across South West London, which means that for a huge number of different services and particular patient pathways, we have a common approach. And that's based on NICE guidelines and on evidence of best practice, particularly Royal College guidelines. And we have a group of clinicians who are actively engaged with that, who've been working on it up to now and who continue to work on that. So we are committed to a consistent approach to clinical policies across each of the boroughs within South West London. I mean, there are tailored approaches in some boroughs to particular services where there's good evidence that the needs of the population are different and require that. And I think that's always been our commitment, that where we need to tailor particular services to particular communities or populations, we will do so. But collectively across South West London, we will commit to best practice and the highest standards of care. I think if there are any specific issues people are aware of, I'd welcome receiving those in the chat or outside the meeting, and we can look at that and respond further in writing.
Thank you, Andrew, for them. That is helpful. OK, Adrian, I'm going to come back to your other questions shortly, but I think we'll just go to Councillor Jenny Gould from Merton Council, who has asked us about our commitment to reducing our impact on the environment.
Yeah, and I think that's a really good challenge. Obviously, we try and do as much as we can paper-free. This is a paper-free event. We've got a number of more significant initiatives in place, and we can probably provide more detail on that in a written response. We are developing a green plan. That's now due in the spring of 2021. We probably would have done that earlier, but with the focus on response to COVID, that's put the timing back a bit. But we're committed to developing a green plan as a South West London CCG. And also, I mean, one of the things I've already mentioned is embedding some of the good practice and learning from our response to COVID. And part of that is our increased use of digital technology, and where that's appropriate, it improves access for patients and reduces unnecessary travel. So it's those kind of things that we would want to build into a comprehensive green plan.
Thank you, Andrew. Okay, so I'm now going to go to the second of Adrian Britton's questions, which you can see in the comments box. And Adrian says, does the South West London CCG have the power to reapportion the aggregate of boroughs' annual funding allocations? If not, how? For instance, can Croydon's comparative 10% funding shortfall referred to on page 43 of the annual report be addressed? So, Andrew, that might be one for you or a panel member.
I think it's probably one for our Chief Financial Officer, James Murray. So, James, can I hand over to you to answer this question? It's a really pertinent question.
Okay, yeah, I can answer that one. So CCGs historically have been funded on a national capitation formula, and that is how that's demonstrated that there's a shortfall on Croydon compared to other CCGs. The new CCGs, effectively their allocation at the moment is based on the consolidation of those 6 CCGs, and part of the coming together of the CCGs, we committed to honour those allocations for the next period while those allocations were published. So what that capitation formula does is it allows a pace of change, which effectively means that every year Croydon get a little bit more money, and some of the other CCGs, not just within South West London, would get a little bit less. So that borough sort of shortfall funding would be addressed through that route. There was obviously a commitment from the CCG on its merger to stick to that. Obviously, the slight fly in the ointment this year has been the pandemic and the suspension of the normal financial regime rules. So it's not been possible to do that this year, although we were planning to do that within our original plans. But clearly, once the CCG gets control back of its financial allocations, we'll look to move towards that sort of environment again. So as soon as that comes in, we'll be reviewing that, and we would, as a principle, across all areas, look to make sure there's equity of funding across all parts of London and South West London. And that's my response.
Thank you, James. That's really helpful. So I'm going to go on to another question. We've got Catherine Hodgson, who is Chief Executive of Paul's Cancer Support Centre. And Catherine is asking, what plans are the South West London CCG putting in place to provide support to people with late cancer diagnosis and or delayed treatment? So Andrew, over to you to take that question.
Thank you, Charlotte. Probably I might respond to that one as well. I chair the Cancer and Specialised Recovery Programme as part of the approach to recovery from COVID. So I've got quite good sight of the work that's going on cancer. It's not specifically a CCG committee. We're working quite differently together as a CCG now with all our providers of health and care services. So it's a very much our programme boards are made up of people from the CCG, but also people from the providers of care. So on my cancer programme board, I've got representatives from different hospital trusts, but particularly from the Royal Marsden. Now, Royal Marsden is a national leader in cancer treatment, and in South West London and working in partnership with North West London, we have Royal Marsden Partners, which brings all providers of cancer care together, and they've been doing a huge amount of work on cancer recovery in terms of looking at the backlog of possible cancer diagnoses and elements of treatment that need to be delivered because of what's happened in COVID. Probably the first place to start is with screening, which is a really critical mechanism for identifying cancer early. Now, in the initial response to COVID, that was put on hold, but all 3 key cancer screening programmes are now back online in South West London, and they all have plans to work through any potential backlog of patients. One of the issues is that actually, although screening services have been made available, not all patients feel confident to come in and access screening. They're worried about the risk of infection in a healthcare setting. I think what we need to say is that we've put a huge amount of work into making all those screening settings incredibly safe. All our staff working in screening use full protective equipment, and the staggering of appointments and the way it's structured means it is safe to access. So we'd encourage everyone to take up all offers of screening. That's particularly for bowel, breast and cervical screening. And in fact, for cervical cancer screening, which is often done in GP practices, each of our boroughs is putting on extra clinics to catch up, to make sure we can work through and pick up any pick up any potential cancers really early. For those patients with symptoms of cancer, the opportunity for GPs to refer has never been switched off during COVID. So we've always been able to refer people with cancer right through the response to COVID. Again, the issue has been people not wanting to come forward with potential symptoms. We have seen a surge in referrals now that we've come out of lockdown, and I think we just encourage anyone with potential cancer symptoms to consult your GP, because we do need to see that, and then we will refer you on. Obviously, it's taken a bit of time because a number of services, particularly services that are key for diagnosing cancer, like endoscopy, were stopped in the initial response to COVID because of the risk of infection. What we wanted to do in restarting services was be absolutely assured that all those sort of services, like endoscopy, again, were safe for patients to access. So we've got really clear processes and procedures in place now, so that all our healthcare settings are low risk if you need to come in for any sort of investigation, and we're starting to work through the waiting list and backlog of patients that has developed because of the lack of access to some of those investigations. I'm really confident, having seen the plans from Royal Marsden Partners, that we have a plan to work through the backlog and to deliver care in a timely way to patients. But obviously things have been a bit disrupted from COVID, but we are overseeing those plans, and everything that can be done is being done to get us back on track.
Thank you, Andrew. Okay, so we've got a couple of questions on testing here. So George is asking, how does the CCG coordinate its actions with the local authorities? Both should be involved in testing and tracing rather than doing it at a national level. And then Brian is also asking what the South West London CCG is doing to improve the testing for COVID-19, talking about antibody tests and fit to fly PCR tests. Brian is saying he has found this very difficult to arrange with no COVID symptoms showing.
Thank you, Charlotte. So I'm sure there'll be lots of questions about the National Test and Trace programme that's run by the Department of Health and Social Care. I do think we should pass that probably over to Sarah Blow, our accountable officer, because Sarah, you've been taking a bit of a lead on testing at various points, and I think you're well placed to talk to this.
Thank you, Andrew. So I think it is important, as you say, Andrew, to point out that there are different types of testing. There is the local NHS testing that we manage in South West London, and that is for patients that are in hospital, patients that are being discharged and admitted, our NHS staff in hospitals, and when we are making sure that we're bringing patients into hospital for elective operations and they need testing. So that's our NHS testing locally. Nationally, the Department of Health and Social Care runs all of the other testing that is for those outside of hospital, including the public, the care homes, and anybody else that's not being treated through a hospital process. We recognise there have been issues, and this is a hot topic, and we have locally tried to support our local communities as much as we can, but obviously the local NHS testing capacity is limited, and we are only given the capacity to test for what we need to test for. So we are working with the Department of Health and Social Care to try and improve the position nationally. And obviously they have a plan to increase testing as we move forward, and we're happy to divert any questions to the department or to take up any issues with department that the local people may have. So we will influence as much as we possibly can on that. On local authorities, we work really closely with our local authorities wherever we can, and we've done a really good job, I think, through COVID on things like personal protective equipment. And when there have been shortages nationally, we have supported the local care home market and local authorities as much as we can from the NHS. So we work in partnership with local authorities, and where we can support local authorities around things like testing, we will do that. But obviously we are bound by the capacity that we have and the ring fencing of that capacity for the use that it is intended. Thank you.
Thank you, Sarah. Okay, so we've got another question from Caroline on obesity. So Caroline is asking us, what support are there for overweight or obese children, which seems to be a problem across all our boroughs, so especially for young people in deprived areas? So Andrew, I'm not sure who you'd like to take that question.
Thank you, Charlotte. That's a good question. I think probably any of our GP borough chairs could take that, because I know there is work going on in each borough. Why don't I turn to Naz Giovanni from Kingston? Could you take that one?
Thank you, Andrew. So just thank you, Caroline, for the question. This is a really important topic, not just for the children, but also for our adult population for the future. It is within our health and care plans within the boroughs. There are specific elements around childhood obesity and ways of being able to tackle it, not just at the 10 to 11-year-olds, but also at the 5-year-olds. We're working with our boroughs on the plans themselves. There are physical elements to this, like the Daily Mile, community exercise programs, food dietary education, and also working with the parents and the educational system to be able to help with this issue. We feel it is the responsibility of all partners that are within the health and care system to be able to do this, and so we're working with our partners to look at the elements that they would be able to provide to help support reducing the impact of childhood obesity. In Kingston, as I said, this is a priority locally, and I do know over at London there is a specific drive from the Mayor of London, and especially when you're talking about things like fast food shops or the chicken shops, as he describes it. So trying to reduce the proximity of the fast food shops to places like schools. Each of the boroughs have specific plans, but this is one of the priorities within all the plans. Thank you.
Thank you, Naz. That's very helpful. Okay, so we've got another question here from Andrea Owen from the Alzheimer's Society. And Andrea says she's concerned that dementia has been almost unmentioned in an hour and a half, but there is a lot of evidence that people with dementia and their carers have been particularly negatively impacted by COVID and the lockdown. And she's asking us, is there a plan for how their needs and deprivations will be recognised and met? So Andrew, I'll hand that to you.
Thank you, Charlotte. I mean, that's a good challenge. Obviously, there's only so much that we can cover individually in the different presentations, but I think it's really important to flag that up. Let me again turn to one of my borough chair colleagues. I'm sure all of them could talk about the work going on dementia kind of historically, but also our current thinking in relation to what we do right now. Patrick from Richmond, Patrick Gibson, could you take this one?
Yeah, thank you, Andrew. Thanks, Andrea, particularly for raising it, because it is such an important topic in all our communities now with ageing populations. So it's an interesting one. So it's an area for celebration, but it's also an area for identifying that there's still just a massive amount to do. I say celebration. Naz and I actually in our presentations did reference that both our boroughs had achieved the standards, the targets that are set for us for dementia, and I know that they've been achieved across all of the boroughs in London, in Southwest London. I don't know beyond Southwest London, but certainly within Southwest London, all the boroughs have met that target. Each borough has a clinical lead on dementia. The point you make in the chat about carers' needs is a really, really well made point during COVID. Healthwatch in Richmond did a fabulous a questionnaire of how the population was getting on during COVID and provided us some really, really useful feedback. And it identified not only the dementia, but actually any situation where you've got a lot of carers involved. Those carers really struggled with the social isolation during COVID. And I would link that into Chris Manning's question a bit earlier about social prescribers, because there is a link there. So one of the things that the social prescribers are doing for the practices is making those links to the shielded patients. And I think as we go into possibly a second surge, I anticipate that we'll be using those social prescribers to be making links into all our known carers. We're trying to encourage that we continue to try to encourage the practices to increase the number of patients on their carer registers. The local authority are the people who train up the social prescribers, but they sit now in the practices, and I think that's what Chris was referencing in his question. And that is really valuable. So for the first time, the practices have got somebody sitting within their practice teams who are naturally linked into local authority. And I think that link will be a very valuable one going forwards, and particularly in the context of making sure that the carers and the patients with dementia are getting a voice, because it gives us that opportunity to make daily contact anticipatory care rather than waiting until a crisis arrives. So I mean, there's still a hell of a lot of work to be done around dementia. There have historically been different levels of investment across the borough and in different aspects of dementia. So there's still opportunity for having a more standardised approach. And obviously we'll be looking to link investment to outcomes, which I think is critically important as well. So I hope that answers the question.
Thank you, Patrick. So yes, we've got a couple of questions now around Croydon. So Agnella, we could potentially go straight to you. So Maureen, I'll just summarise, Maureen, what you're asking. You're a Croydon resident and you're asking about the need for medical facilities in the south of Croydon and discussions over the last year. Maureen is asking for confirmation that funding will be found this time for the Calat Health Centre in Coulsdon. So that's the first question, Agnello. And then I'll just follow that up. You could also answer Michael Keane from the LPC. Michael is asking us, he's saying COVID has seen a reduction in the use of community pharmacy consultation scheme via Vocare. Will the South West London CCG be supporting better use of this scheme to support urgent care? So perhaps Maureen's and then Michael's, Agnello.
Thank you, Charlotte. First of all, as Maureen knows, we've had ongoing discussions in Croydon, and the number of different health facilities really reflects the population densities across Croydon. But it has been recognised that south of the borough, especially Coulsdon, is an area of real need from a health inequalities point of view, and so a lot of more activity is going to happen in that area moving forward. Discussions are already taking place relating to estates in south of the borough, and the primary care networks are fully involved in that as well. So we're hoping that the projects that have been started actually will start to progress. Capital funding is always difficult in terms of availability, but I think that the need in the south of the borough, especially the Coulsdon area, is well recognised. And personally, I think we need to start moving forward on this, ensuring that we meet the needs of the people in the south as much as everywhere else in Croydon. Sometimes there are competing competing areas, but we need to follow what Maureen has been saying and what the residents of South Croydon have been saying for a while, is about ensuring that we have more services to meet the needs specifically of the needs of the people in the south of the borough. So I think going forward we can certainly see more of that happening. On the second point relating to vocare and pharmacy, certainly use of pharmacy is a critical part of the urgent emergency care plan, not only nationally, regionally, but also in South West London. And as Think 111 First gets launched and Croydon gets launched today, and the rest of South West London will go live in the next couple of months, it'll be an integral part of involving local pharmacies and LPCs in terms of how we can improve the offer to patients, having had callers to 111 assessed through a clinical assessment service, who will be best served by the needs locally from the pharmacy, their local pharmacies. So it's very much on the cards, and it's an integral part of reforming the urgent and emergency care system. So I can only support that we need to be doing more. The plans will be there, and in terms of implementation, you'll see that in terms of months rather than longer. Thank you.
So are we going back to you, Charlotte? I think we're out of time, aren't we, in terms of our planned finish? So that's probably all the questions we can take for now. What we will commit to is to respond in writing to any of those questions we've not managed to tackle as part of the Q&A session. It really just falls to me to say a big thank you to everyone involved in preparing for the AGM and helping us run it, and thank you to those members of the public as well who've dialed in to take part in the AGM. We really do appreciate your interaction and your challenging questions. That's a really key part of how we test what we're doing and make sure that we are listening to the voice of the patients for whom we're commissioning services. I think it's just worth saying before we close, we will be uploading a recording of the AGM onto our website within the next 24 hours. We will also upload the slides that we've used onto the website, so that you've got that information going forward if members of the public would like to look at that following the AGM. So thank you again to everyone involved. Thank you to, as it's an AGM, to all the teams in the different 6 CCGs for all the incredible work that you've done over the last year. And then thank you as well to everyone in the CCGs who's come into the new South West London CCG, but also to all our partners in the health and care system, to our local authority colleagues, to those working in communities, including people in the voluntary sector and carers, for everything that you have done collectively to help us deal with the biggest challenge we've faced in the NHS in our living memory. And we will continue to do everything we can to respond well, to give patients the care they need, and to listen to the needs of our communities to make sure that we are planning services that really do hit the mark. So thank you, everyone. That brings us to a close.